Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. So now, as she was explaining to me and telling me just a moment ago, that her main complaints are one, has a lot of pain and tightness in that upper back, kind of following the traps here. Also, the secondary and kind of more problematic issue is she's been experiencing digestive issues. Would you like to tell everybody kind of what's going on and things that you've done already?
Okay, so I've been to the doctors several times and they're telling me to take all this medicine, and I'm trying not to take any medicine. I want to get this resolved.
Do you know any of the medications that they've...
No, there's been several.
Okay.
But with that said, my point is just to get to not having any issues with my digestive. Everything just kind of sits inside me, like nothing ever comes out.
So now as you were telling me earlier, you've already cut out dairy.
Yes, I don't do dairy, I don't do grains, no eggs. I'm pretty much stuck with like vegetables and any like
your
meats.
Chicken, your proteins.
Yeah, my meats, my chickens, my fruits, vegetables. I do like the vegetable style noodles. That's the closest to like a noodle I'll go with.
Okay, like a pasta or something. Okay.
So.
And still, everything when you eat, you're just nothing. And
it's like you have to take Miralax like 3 or 4 times a day just to get anything to flow.
Gotcha.
You know, and even like I get it, it's over the counter, it's okay, but you shouldn't have to. Like your body should naturally just go. Yeah,
especially when you're starting, and as you can tell, she's already dropped. Now, how long have you not been having dairy for and things like that?
Since I was probably in my early 20s.
Okay, and
I'm 34.
Okay, so now as you can tell, so this is not like just like a quick drop this out for a week or two. This has been
ongoing.
Years.
Yeah.
So she's dropped dairy out of her diet. She's dropped obviously dairy, including your milk, your cheeses, things like that. You've dropped eggs out, and then your grains. So with that already, you would think that her body should be responding. Now that you're putting real food in you, it's not like you're eating all processed, like the chips and whatever and candies. So you would think that your body should be responding and should be able to actually break down and to actually digest this food. But now there are just some things that people don't realize, and actually, so I have a very good experience in digestive issues with patients just because of the first office I actually worked at. So I'm very, very, very aware of complications with the digestive tract. And one thing that I always tell patients and how I describe to patients is if there's any pressure that's being put on the nerve, and just say that nerve is going to your small intestines, your large intestines, your stomach, if you have pressure that's being put on it, over time, can that pressure cause a loss of function in those areas? So what I'm going to do, and what a chiropractor does, is they find areas where there is pressure being put on those nerves. They remove it with the chiropractic adjustment to allow the body to heal and to function as it should. So a lot of the times, if you sit there, you've done the good thing and you started, the whole change in your foods and things like that. That's already the number one thing, when it comes to a digestive issue to look at and to change. But now she's coming to the point where that isn't helping her. The medications that you're on, you take one thing and then one thing may get better, but then you have 10 different side effects with one medication, which then leads to another medication, and now you got to take this to help with this because caused by the first medication, and it's like a domino effect when you start getting into all these medications. And as you can tell, so you've got a healthy 30-year-old here that is now almost being dependent on all these different types of medications, and which is, just...
I do have another question.
Go for it, shoot.
Could my slouching, because it goes like halfway down, is that in the area where could I be pinching like a nerve, which messes up with the digested? Like, could that have something to do with it, or are they just totally two different things?
Nope. They're not two totally different things.
Okay.
So depending on the different areas of the spine, is going to depend on what actual nerve exits what level.
Right.
And at that nerve root, you know, it could correlate to, you know, your colon. It could correlate to your, you know, small intestines, your large intestines, your pancreas, you know, your stomach, your gallbladder, different areas.
Okay.
So, yeah, with that slouching, you know, especially when you get into the lower thoracic, you know, from your like T6 down to T12, those nerve roots, yeah, if there's any type of pressure being put on those nerve roots, yeah, you know, if your nerve to going to your stomach, you know, isn't working or isn't functioning as it should, you know, now that may be causing an enzyme to not being properly dispersed at the right moment.
Okay.
And so now if you're not getting that proper enzyme at that time, that may then, you know, now you're getting food that's going into, starting to go down in, you know, into your intestines. But now if that enzyme hasn't already activated and started breaking down the food in one process, now into your intestines, the next enzymes that they send out may not be, you know, breaking down that food how they need to. So it's like a domino effect even with your body. So as with chiropractic, what we're going to do, we just want to take pressure off those nerves, you know, to allow them to heal and to function as they properly should. So what we are going to do today, we're going to do a full body chiropractic adjustment. We're going to start usually up in the top, make our way down. Before I do an adjustment, I like to normally do a soft tissue workup just to kind of help relax any taut, tender fibers that I may find. And just by standing here and pushing in, your traps are very, very taut and tight. So what I'm going to have you do, I'm going to have you lay face down for me. Okay, so like I start every adjustment, I want to go through and I'm going to scan the entire body. I'm looking for symmetry from one side compared to the other side. So as we're coming in here, you know, feeling through, you know, that cervical spine up in the neck. That left side's feeling a little bit more tense. But, yeah, still tense because that trap muscle, how the trapezius muscle attaches, it's going to attach onto that base of the occiput, kind of that EOP going down, and then it's going to come around, it's going to follow the spine, it's going to come out, and then it's going to come back down. So a lot of this, especially right in through here, is, yeah, I know you feel that when I push in here. Yeah, it's all pretty tight through here. But we're going to start kind of scanning right down on the spine. Now let me know if anything is tender to the touch. Okay. Yeah, as we're going down, so in through here, you know, I'm looking at everything. I'm looking for areas that are raised up. Kind of noticing on this left side is a little bit raised up here compared to the right. And then even looking at her shoulder blades, this right shoulder blade is kind of protruding back out further than the left. So things like that I'm looking at. And yeah, actually even right through here.
Those are tender.
Yeah, this is all tender. And now this is the area where the nerves that are exiting the spine are affecting that digestive tract. Okay. So this is what we're going to work on a little bit more heavily today, and then we'll go from there for later. Any pain over here on the right side?
No.
Any pain on the left side?
A little bit.
A little bit on the left side. Any pain directly over the sacrum? Okay. So she has some pain directly over the sacrum and then also on that left SI joint. So we're going to come down here to the edge of the table. And we'll bring these feet together. That right side's looking a little bit short with the leg length here. As when I scan up, so when I'm scanning up, actually hips are looking level, just that one side was looking a little bit higher here and then a little bit higher on that side. But she's having a lot of pain right through here. So what I'm going to do, I want to relax the muscles right in through here in that kind of mid to lower back, and then also going to hit the muscles up in the trap areas up through here, just so when we do start to make the adjustments, it'll allow her body to be a little bit more relaxed, so it'll be easier for her to get adjusted, easier on me to actually adjust her. But then also after the adjustment, what it'll do, it'll help the adjustment last longer and hold a little bit longer because her muscles aren't going to try to pull it back out of alignment. So let me grab that soft tissue device and we will start from here. Okay. Okay, so as what I'm doing, I'm going through and I'm actually kind of following the trap and just letting things relax from here. I'm using the Hypervolt with doing this. Great device, you know, just a portable manual massage device. So this thing actually works really well. How's that feeling on you? It's vibrating the heck out of you, isn't it?
Oh my god, yeah.
Probably some spots I'm going through are probably even a little tender and a little sore.
Very tender.
Very tender. But yeah, so we're just going through. We're gonna get this, you know, nice and relaxed, or as best as we can before that adjustment. Okay. So now that portion's good. Now this is probably gonna be a little bit more tender to you.
Okay.
Through here, so I'm actually going to put it on a faster setting, but I'm not going to really be putting any pressure in. How's that feeling through here?
Tender.
Tender? Okay. So this area is going to be the area where those nerves are actually affecting her digestive tract. You know, between the lower thoracic and the upper lumbar nerves. Those are going to be the main complaint and concern from those digestive issues. So we're going to first, as I already explained, we're going to help relax the muscles in this area. So then when we do go ahead and make the adjustments, it'll help move it a little bit easier. It won't be pulling, it won't be as restricted. How's that feeling?
Oh, it hurts.
It hurts. So I mean, it's something that needs to be done. I'm not trying to torture her or her body, but yeah, these are things that, you know, it's not going to be the most comfortable feeling at times, but it's things that, you know, that does need to be done to one's body. Yeah, just a little bit longer and I'm almost done with this. There we go. There we go. So what that did, I mean, I know that you felt all that vibration. We're just, you know, help relaxing those muscles. I know it can be painful, but, you know, that's just what's been happening for years. So let's go ahead and we're going to start the adjustment now, okay? Mm-hmm. So I like to start my adjustments right up here in that cervical thoracic area. So we'll come in right up top. So I know this was one of her main areas, you know, especially anything following that trap. So we're gonna come right in through here. So we're gonna do a T2 over here. Good. How'd that feel?
Awesome.
Okay. I'm gonna drop down to about a T4 on this one here. There we go. How was that?
Good.
That just opened up and released a lot of pressure off those nerves through there. So now what we're going to have you do, that you're in the prone position. Prone just means lying face down. Mm-hmm. We're going to do that upper thoracic adjustment. It's just going to be a P to A, which means posterior to anterior. So I'm going to have you take a deep breath in. Exhale all the way out. Good. One more time. Deep breath in. Exhale all the way out. Good. So definitely got some good movement right in through here. Now that we're getting to this lower area, what I'm going to have you do, I want you to sit up for me. I want one leg on either side of the table as if you're to straddle the table. I'm going to come from behind here. And it was that left side that was raised up a little bit more than the right, so I'm going to have you sit up nice and straight. Bring this arm over, just like that. Good. So I am going to rotate you all the way over. I want you to look as far as you can over your right shoulder. With your thighs, keep them just squeezed to the table. Oh. How'd that one feel to there?
It felt good.
Yeah, so I mean, as you could tell, just with that had a lot of movement there. So there was a lot of pressure that was put on those nerves. So we could help release that a little bit. But yeah, what was happening with your spine, things are just getting twisted up. And so we need to kind of remove some of this. So there's a little bit higher, that area through here that I want to get on the opposite side. So we're going to do that same thing, except we're going to rotate to this side. Dice at the table. And there we go. So you felt this side was up a little bit higher with that movement. This one was a little bit lower. So the adjustments look the same, except the actual contact on where I'm making that adjustment was quite a bit different. So that's going to help relieve a lot of the pressure in that lower area. What I want you to do, I want you to lay back face down for me again. Okay. So now what I'm doing, we're going to come back here, look at her leg length, and actually even with that, is balanced out quite a bit more than where we were at originally, which is a good thing. Now originally when I was pushing in here, how is this feeling in this area?
It feels much better, actually.
It feels much better, okay. And before, I know just even as I was palpating down the spine, that was an area that was actually bothering you quite a bit. So, you know, when you relieve that pressure and you remove that pressure off a nerve, already that quickly, just the touch perception of pain has already gone away. So now, you know, it may take some time, it may take a few multiple adjustments for her to really get a benefit from helping with digestive issues. But the more we take pressure off the nerves and allow the body to function, the better her body will start responding with her digestive issues and being able to, you know, actually eat, consume, and, you know, just the entire process of the food will actually be able to be a lot more stable and a lot more regular. What I'm going to have you do is I'm going to have you lay on your side and face me this way.
Okay.
I'm going to have you bend this top knee. Good, just like that. I'm just going to roll over. Yeah, just like that. Good. There. Flip to the other side for me. Just a little one compared to the other side. Lay flat on your back for me. Okay. So now from here, looking at her feet, leg length is balanced, which is a good thing. What I'm going to have you do, I'm going to have you sit up now. Come on up, come forward. So how's that feeling up through here?
It feels good.
Good. Alright, so a couple more things that I want to do. One, we're going to make sure and clear out the cervical spine. Then we're going to do another adjustment in that upper thoracic area, just because that was an area that was pretty locked up and one of her chief complaints. So we want to just make sure and address this area really well, just because we already got a ton of movement through that middle lower back for her. And then from there we're going to do the manual decompression and just make sure and take pressure off all the nerves going down. So yeah, up in the cervical spine, let's see here. A little bit more issues on that left side compared to the right. So we're going to start from here. Have you laterally flex. We're going to rotate you towards me. Good. We're going to just make sure, feel the other side. Okay, a little bit of tension in here. Laterally flex, rotate. Good. Good. So the reason I kind of, as you can tell, I'm putting her to the end range of motion, and the one thing is I tend to get patients that, you know, you feel their muscles tighten up a little bit. So I'm kind of just playing with it until I feel them relax and let go, and then it's boom, and then we make sure and we can really make that adjustment very well. So what I'm going to have you do, I'm going to have you stand up and face that way for me. Arms out by your side. Yep. Put your hands up and over mine. Okay, so I'm going to lean you back on the knee. Squeeze your elbows together. Harder. Good. Relax. Okay, so that area was already cleared out, which is a good thing. I'm going to do one more. I'm going to have you take a seat right here. Okay. So originally we did the P to A thoracic adjustment. Now we just went for that standing. So now let's make sure we're going to do an anterior thoracic adjustment, just to make sure everything is cleared out here before we use that Y strap. Okay. So I'm gonna have you take a deep breath in and exhale all the way out for me. Good. Already cleared out. I'm gonna have you just relax, stay right there for me. And so now we're gonna use the Y strap today.
Okay.
So now this is that manual decompression. I know you haven't had this done yet, so this will be a first time with the Y strap. But yeah, you'll feel with this. The strap's gonna wrap around the base of the occiput, and you'll feel every vertebra from the occiput going all the way down to that lumbar spine. You'll feel them open up and pressure being removed off those nerves.
Okay.
Today that it is the first time, I do go a little bit lighter, just so you do get like a little bit of an understanding of the feel, and that I'm trying to get a sense of your body and how hard I can do a pull. So it may not go all the way down, but you'll notice it. If you want to pull the rest of your hair through for me.
Oh, yeah.
Perfect, thank you. Okay. So with the Y strap here, we're just going to distract out in the Y-axis direction.
Oh my God.
And relax it just for a moment.
Okay.
Now, obviously with that reaction, I could tell you felt how
I
that...
felt all the way down.
All the way down?
Yeah.
Okay. So even with that, I started off, like I told her the first time, lighter with the Y strap, and it is such a powerful adjustment. That one adjustment you felt
everywhere.
Everywhere. Yeah, that literally, it decompresses the entire spine. So all the way from that occiput, like I told you, going all the way down.
Yeah.
And you just feel that, and you feel even the pressure getting removed off those nerves going all the way down. So, yeah, how would you describe that to somebody? I know.
It's kind of like, you know how you crack your knuckles? But it's being done like all the way down your back. Like you do like the little, but it's the whole thing. Like I guess that's the only way I could figure out how to explain it. Yeah, that was crazy. Oh my God.
Feeling good though?
Yeah.
Okay. So now, for me, what I want to make sure and do is I'm going to follow up, and we're going to just make sure and see just how things are feeling. One, because your two main complaints were, that tightness, tautness, all in that upper back area, and then obviously with the digestive issues. So, obviously with one adjustment isn't going to be a complete, fix it all, but, especially how I adjust, I'm a little bit more thorough and a little bit more, I guess the best way to put it, when you leave after seeing me, you know that you've been adjusted.
Right.
So, yeah, you can definitely notice a difference, and your body will notice a difference too.
Okay.
So let me know kind of how the digestive issues is going. If you notice a change, if you see a change, just kind of keep a record of things. If you need to write it down in a journal, definitely feel free to. And we'll follow up in the next couple days. We'll do another adjustment, and we'll just see how things are going for you.
Perfect.
Perfect. I'm Dr. Joseph Cipriano. If anyone is looking to schedule an appointment, I have everything in the description. I'll have you go right to my website, www.drjosephcipriano.com. Feel free, under the contact me, leave me a message, and I will go ahead and get back to you on that. And I have a new office that is actually being opened up in Spartanburg, South Carolina. Finally have gone on my own, so there is no other saying I'm the boss, the owner, and it is finally going to be done my way and for the best care of any and every one of my patients out there. So I know I've had a lot of people that have been leaving me messages and kind of haven't really heard a response back. So the next couple days I will be going through and answering every one of those emails, and you guys will see, and we'll get you going up and at the new office starting November 1st. So I will definitely have more in next videos, and you guys will definitely see it. I'll do a live video at the new office and show you guys everything, okay? Have a good one, everybody.